So, overactive bladder with or without urge urinary incontinence is one of the conditions that is most common in our older adults living in long-term care settings. And we're most likely to see this in women who have gone through menopause. And I mentioned earlier, the farther out a woman is from menopause, the more likely or the more at risk she is for having some symptoms of overactive bladder and possibly some loss of urine. We also see this with persons who have neurologic conditions like Parkinson's disease is a really good example of that, where again, how the messages are moving from the brain to the bladder are really altered. Urine or overactive bladder is this involuntary or overactive bladder with urge incontinence is this involuntary loss of urine that occurs pretty quickly after feeling like you need to go to the bathroom. So you get this very urgent need to go to the bathroom. And what happens for most people is that you get a message throughout the day that your bladder is starting to fill, and you kind of make a decision about, I need to go to the bathroom, but I can wait a little bit. And we call that the first urge, or when you first notice it. And then if you're not able to go to the bathroom, which is what happens to a lot of nurses, all of a sudden you get this immediate urgent need to go to the bathroom, and you've got to get there now. So the commercial is true, right? You got to go now. And that's considered the must urge. And so for some of our patients with our residents with overactive bladder and urge incontinence, they don't get a very good first urge, and so that also contributes to the urgency. Many times they lose urine before they go to the bathroom, and they do not have the ability to stop that urine stream or suppress it or keep it from happening. So the ICS, or the International Continence Society definition, includes urgency with and without incontinence. Urgency is described as this compelling desire that occurs very suddenly to pass urine, and you have a really hard time putting that off. This is where patients or residents will tell you, as soon as I get back to my room, or as soon as I get in the car, or as soon as I get into bed. And they have different times where they really notice it. Frequency is often also a concern, and it's pretty normal for people to go to the bathroom every 2 to 3 hours. Now, our older people can't hold quite as much urine, many of them, but certainly going more frequently than every 2 hours should alert you as the nurse that maybe you want to watch or further assess for overactive bladder. It's normal to get up 1 or 2 times at night to go to the bathroom, but any more than 2 times you really want to think about the issue related to nocturia. And men are much more prone to nocturia than women, and a lot of that has to do with prostate enlargement. And then we talked about urge urinary incontinence, this involuntary leaking or loss of urine.